Hi, and welcome to CVS Health Live. I'm Jessica DeMassa. Have you heard the stunning statistic that our zip codes are often better predictors of our health than our genetic codes? That's right. The neighborhood where you live is likely to have a bigger indication on how healthy you are than your DNA. Today, we are going to meet some community leaders who can help us understand why that is, and we're going to introduce us to some of the initiatives that they're working on to help improve the fabric of our communities at the neighborhood level so that we can all benefit from greater collective health. So please join me in welcoming our guests today. We have Reverend Dr. Vincent Campbell. He's the senior pastor at Ebenezer Baptist Church. From the city of Pittsburgh, we have the executive director of the Housing Authority there, Castor Binion. And from CVS Health, senior advisor for workforce initiatives, John White. Hi, everybody. Welcome. Happy to have you here.
Hi, Jessica.
Yes, glad to be here.
Hello, Jessica. Thank you.
Thank you.
Hi. All right. I am so excited to talk to you guys about this today because I do think that people don't realize just how much their neighborhood and their community contributes to their health. So let's jump right in and start our audience out there. So John, I'm wondering if you can help build some understanding about this. Can you please kick us off by providing some examples of these factors and needs at the community level that we have and how the social determinants of health, for those who might not be familiar with that terminology, how those social determinants factor into our well-being?
Sure. So one of the things that, we look at when we look at programming and our workforce team are those social determinants of health and how they affect the community. One of the things that we look at is, the health disparities and access to healthcare, transportation, access to housing, along with access to food. And a lot of the times in the communities that we serve, there's a lot of different people working on these initiatives separately, but trying to bring that all together so that an individual is wrapped around services.
And Castor, in your role, you're seeing firsthand the role of public housing and how this can impact all aspects of a person's life. Jump in here and provide some examples about how poor lack of access to housing can compound and result in poorer outcomes. And also, if you can maybe speak to some of the things that John brought up as well.
Okay, so as you know, housing have a direct impact on the health and safety of a family, and also have an impact on the next generation. If you don't have foundation in the house and be safe, it's hard to get a job as you sleep in a car. It's hard to get a job if you live in a shelter. But with community partners and public housing and the Section 8 Housing Choice Program, we are able to assist people with housing. When you have housing, kids can do their homework. Families can get opportunity to work together to work with workforce, and also get accessibility to wraparound services that what John talked about as far as providing other resources to families to make them successful. Housing is very important, and some of the things that we are doing is we continue to build affordable housing in the city of Pittsburgh. We probably have over 20 or 30,000 people who need housing. We do work with a home ownership program, self-sufficiency. We're working with partners like you guys to make a significant difference in family life. Housing is a basic need for everyone, and by having a basic need taken care of, you can successfully link to other resources to better your family and quality of life.
Reverend Dr. Campbell, I understand that before you became a pastor at Ebenezer Baptist, you were a community organizer. And I would love to hear from your perspective, why is it so important that we address these challenges at the local level?
Thank you, Jessica. Well, it's because most of the services that people in poverty receive are based on guidelines. So it's not based on an individual coming down and sitting with someone, telling their story, talking about their specific needs. And so, we talk about those social determinants of health, those are just, big box things: housing, transportation, childcare, employment, education, healthcare. But then inside of those big boxes are individuals, right? And so let's say transportation, if you need transportation services, you receiving those resources are based on guidelines. So if you go to the bank because you want to buy a car, well, you have to make a certain amount of money. You have to have a certain credit score, right? You can't go in and say, well, here's my situation. Or can you tailor a loan for somebody in poverty? Doesn't work like that, right? So what we're able to do when you talk about the grassroots level is we're able to work with the individual. I love that about the way that Castor's team approaches housing. Yes, there are guidelines that they have to follow, but they also have partners like Ebenezer to come in and fill in the gaps. And I like to think of that's what we're doing. We're kind of filling in the gaps in between the services that they receive from government agencies and sometimes other organizations. So I'll say real quickly, we have individuals who need food, but certain food banks, they have guidelines. So if you don't have an identification card, if you aren't willing to give up some of your personal information, or if you've already been here this week, sorry, you only get it once a week. We aren't bound by those particulars. We're bound by the needs of the individual. So we're more focused on what are the individual basic needs versus what do the guidelines allow for the individual.
That's so interesting. And Reverend Doctor, I'm going to stick with you here because I'd like to take this one step further. You did a beautiful job, I think, of explaining, some of the bigger needs that need to be fulfilled within the community. Let's shift a little bit and talk about some of the workforce initiatives. I'd like to get an understanding from you. And then Castor, I'd like you to weigh in afterward. Before we dig into specific workforce initiative programs, if you two could help us understand some of the challenges that are being faced in the communities that you're actively involved in when it comes to gaining employment.
Okay, so one of the things that we wanted to do, working with partners, I have the thing about there's a lot of agencies that assist low-income people in training. However, at the end of the day, that person sits at home with a certificate on their wall without employment. And so we started looking for partners who have very significant type of training that at the end, they work to assist them to get jobs and to work to assist them not just get regular jobs, but good paying jobs that they can support their family. And working with partners, then we link in the resources from the government, which is home ownership, money to set aside, and also wraparound services to allow a family to be successful. So as far as training, we have went out and seek partners who can give us critical mass training that end up with success and measurable. And that's probably the better way of doing it instead of just giving some organization some money to provide training. We looking at the end result. How do we have an impact on the family and sustain them at the same time provide self-sufficiency?
Reverend Doctor, what would you say about some of the barriers that need to be overcome in terms of, what challenges people are facing so that they can even get that workforce training?
Yeah, so I like to think of workforce not in terms of just employment, but I think of workforce as creating opportunities for underserved individuals, right? So that's what we're doing. And so it can't be just cookie cutter, right? But it has to be individually cut. Because we know that the individuals, if there were no barriers, if there were no issues, they could go to that employer and get a job without need of a workforce program, right? So the wrong approach, in my opinion, is to think of this as just employee training, right? I'm just training you to be able to do a job. That's not our approach to workforce. What I've got to do first is I've got to tell you that, hey, I can help you create an incredible opportunity for your career path. I've got to inspire you. I've got to inform you. Many of the individuals don't even think that this is an opportunity that would ever be available to them, right? You have someone who maybe all their life work for minimum wage. Maybe they didn't finish high school, or they finished high school, but they have no education beyond that or any real work experience. So they're not thinking that this is an opportunity for them, making $15 an hour or more. So that approach is talking about the opportunities, helping people dream their dream and then working with them to fulfill it. And so not focusing on the barriers per se, but focusing on the opportunity. We know there are barriers there. That's why they're in the program. And we'll get to those barriers, but first, let's approach it positively and not like, oh my goodness, we got to help you get transportation, or you don't have childcare. No, we're going to approach it as you have opportunities. You could be a farm tech. You could work with retail and become a store manager. Or in the case of Larry Merlot, you could be a farm tech and become CEO, right? Come on. I mean, talk to them about the opportunity. Workforce is about opportunities, right? And not just getting someone a job or training them for employment.
All right, John, let's bring you in here, John, because I think Reverend Dr. Campbell did a great job of teeing you up. So I want to hear about the longstanding role that CVS Health has played in these types of workforce initiatives, and what the goals of those programs are for CVS Health, and how do you work with community partners like those great folks over there at Ebenezer Baptist or the City of Pittsburgh or any of the other organizations across the country?
Yeah, and Pastor did a great job of setting it up. So CVS Health has been in the workforce field for over 20 years. We do workforce programming across the United States. We have a team that goes out and finds community partners, and those community partners are kind of the bridge to everything we want to do. And within workforce, our goal is breaking down those obstacles and breaking the cycle of poverty. And the cycle of poverty spans generations. So our goal is not only just to focus in on those individuals that might be looking for work, but also looking at the whole family and taking a holistic approach to it. And the only way we can do that is through partnerships. CVS Health brings a lot of resources into the community, but those resources need to be dispersed, and we need our partners, and that's what we really tie back into our partners by coming in and, like Pastor said, looking at workforce and creating an opportunity for someone. And that opportunity means, breaking down barriers, but it doesn't just end at a job. And a lot of times when we get into these workforce areas, we see that a lot, where once the job is there, or once that certificate is met, like Castor had mentioned, that's where a lot of the support ends. And we know that, someone didn't take 6 months to get into poverty. It's not going to take them 6 months to get out. Giving them a job sometimes puts them to a point where they have to make choices. And we call it the benefit cliff, where they get to a point where they have to choose, do I stay working, or do I have to go back on assistance to support my children? So finding those career paths, finding a way to bring those resources to them to say, when you hit that cliff, you're not going to fall off. We're still here to support you. And through that, that's where partners like Pastor Campbell, Mr. Binion come in and really bring their resources in. And we can focus in on those individuals. With our workforce team, we are very open. We don't, we have programs, but it's not specific. It goes back to what Dr. Campbell was saying around, we have to focus on the individual, and not every program is going to fit that individual. So we have to make the program fit the individual.
Thank you so much, John. I think, you've really done a beautiful job of explaining the nuances, just how complicated it is, when it comes to trying to break the cycle of poverty. And Castor, I'm wondering if we can come to you. And, John alluded to several other factors that might be of importance, beyond just finding a job. And I mean, you've talked a bit about housing, there's food insecurity, there's, childcare, transportation. What other areas of focus are you working on, when it comes to working with low income populations?
So one of the things that we are looking at is, how do you build wealth? The first step is, workforce. Then once you receive wraparound services and mature to a certain point, in your family that you want to achieve home ownership to build wealth. That's the other part that we are adding on. And so it's like when you engage this program, you start at I guess you would say, at the elementary level. And as you mature to different steps, as these resources come in to remove these obstacles to allow you to be successful, we continue to get you to a point where you can get to home ownership and build wealth, which is the American dream. But at the same time, it's a long journey and it's commitment. Some people would start this process, they would drop off, they pick back up, they drop off, they pick back up. Just like John said, the wraparound services are very important. The pastor and his crew to build that rapport, among this population to make them successful is critical too. So, the Housing Authority, as we look at these resources, we look at self-sufficiency and the different programs that we have, government programs, that can be coupled with partners to make a significant change in what's going on now and direct impact of the next generation. Because when you improve the family, you improve the next generation. Some of the programs that we have, by working with the family, we see kids now begin to start going to college. We see kids to do better in school. We see that, housing have an impact, but at the same time, these social programs and partnerships have the family grow in a way the trajectory of their next generation is significantly impacted in a positive way.
Reverend Dr. Campbell, what would you add to that? I mean, I think Castor mentioned a few, some of these social programs and the role that you and your team play to augment what he's doing over there at the city of Pittsburgh as part of the housing authority. So when it comes to your work, in terms of breaking the cycle of poverty, what factors are really important to you and your team?
I guess I respond by sort of saying that you don't have to be poor to understand poverty, but you do need to have a certain proximity to poverty. In other words, it's not something that you can deal with from afar. So you've got to be on the ground. You got to be at that grassroots level. And there are people who say, wow, these people are poor. These people need help. Let me send help, right? And that's usually not the help that individuals need. What workforce programs and our approach, our two-generation approach to providing basic needs and services and even workforce is hands-on, right? It's practical. It's not being afraid to have the necessary proximity to poverty to help individuals. And so those barriers that we talk about, you have to take hold of them for the individual, right? And that's maybe a conversation, but sometimes, and most times, it's rolling up your sleeves, right? And explaining a math problem one-on-one, explaining how to use this technology and why is this technology important and how are you going to use that when you're employed, right? It's all those things. And so I think that the approach is just as important as the actual offering, right? So whatever your program is offering, great. You're offering people food, but do they have to give up their dignity and respect in order to receive that service, right? You're offering, childcare, but are you just offering childcare for me so I can get through your workforce program and become another statistic that completed? But as soon as I get the job, the childcare goes away. But your program accomplished its goal. It graduated me, gave me childcare to make sure that I was in class every day. But now the store manager is saying, gosh, you're a great employee, but, you got to do something about your childcare. You can't keep calling off because you don't have childcare. And that's what I mean by what is that approach? Understanding that individual's plan. What's your plan after you finish this program? How are you going to continue to take care of those basic needs? And do you need us to remain there until we can figure it out?
So one thing I like to add real quick is, as the pastor was saying, the approach of the program makes a significant difference. You must build rapport. You must build a relationship. You cannot be just like a machine. It's just like, hey, you come here to train, yeah. However, you have to build some type of relationship. And I think that this is what this program will be doing, building a relationship where a person can feel safe. And like I said, do not feel embarrassed because they want to achieve. And I think that's make a significant difference in the relationships. And relationships really, really makes the difference in building that rapport.
Let's talk a little bit about impact, if we can, please. So, Reverend Dr. Campbell, I'll start with you. Give us a sense of some of the impact that you've been able to make through your work.
Our motto here at Ebenezer is we are a life-changing church, right? And that's what we want to see. We want to see life changes. And that's a life change in someone's career. Sometimes it's just a life change in someone's relationships. You know, we have to realize that anyone who has lived in poverty has experienced trauma. Okay? And you'd be amazed at, especially younger people, young adults and teenagers, how, as Castor was saying, you build a relationship and a rapport with them and get them to a place where they are ready to deal with some of the trauma that they've been through. And you realize, wow, you know, there's not a whole lot more. They can figure it out. Like they can do this, right? But they came with some trauma that no one wants to talk about or deal with, you know, and they carry that through whatever program or whatever career they go into, and that trauma's still there, and they never, you know, they're just these underachievers because you don't see the trauma. You know, people who live in poverty, they don't live for success, they live for survival, right? And that creates certain habits. And survival habits are not the same as success habits, right? So how do I get that person now to get out of that survival mode and get you on a mode of success? Well, I don't do that by telling them, hey, you know, stop doing that. That's not, no, how we do that is we deal with the trauma. We deal with what is it that had them in that survival mode, right? And they will naturally be on that path to success and start developing those habits or accept the habits that would make them successful. So the impact is on dealing with what are those barriers? What are those things? And sometimes it's mental, emotional. Sometimes it's alcohol, drug, or mental health issues that have not been properly addressed, right? And so if you want to impact the individual's lives, you've got to deal with the things that have already impacted the individual's lives, right? It's not just, oh, I'm going to do all this good for the individual, and that's going to automatically be enough to overcome all of the bad that has been done to this individual. So you've got to deal with both, not just the impact that you want to make, but what about all the negative impacts of poverty that poverty has already made, right? And we're talking about generational poverty here.
Just add something real quick, is you might be talking about the individual, and like the doctor was saying, is that you got to look at the whole family, because the whole family, like I said, they have to be engaged. You know, if the wife is engaged and the husband is not, and then, you know, you got a conflicting situation that you bring to, you know, create a problem. So the approach I like is, you know, everyone is engaged and everyone looking at it as a family accomplishment to get trained and be able to do better things for quality of life.
John, I want to bring you into the conversation here to talk a little bit about where CVS Health is continuing to expand its own programs to help address just the totality of this problem. And so $600 million investment specifically going to help address the disparities contributing to social inequity. Can you talk a little bit more about that for us, John, and tell us, who else is CVS Health partnering with?
Yeah, so we partner across the United States. So there's a lot of different state, local, and federal organizations that CVS is partnered with to really make an impact on the different areas that we're going into. Each area is very unique. So never the same thing in each area, never the same resources. It's usually tailored to what that area is. But some of the stuff that we're doing, focuses around our partners in the faith-based realm, partners that focus on second chance opportunities, deferment opportunities for youth, because we know that individuals in populations that are exposed to poverty a lot of times will end up, having an interaction with police. So how do we change that interaction, and how do we kind of create that? And that's some of the stuff that we do working through this. And those individuals could be an individual with a disability. It could be a veteran that's homeless. It could be, someone living in poverty, in a community. But we're looking at how can we expand that. So across the U.S., like I said, we are building what we built here in Pittsburgh, which is a Workforce Innovation Talent Center, or WITSI as we call them, that brings all of those resources to one place. So it's kind of like a one-stop shop for everything, but also understanding that in these times, we have to be able to take those resources out. So a lot of what we're doing in these different communities are bringing those resources to the community instead of asking them to come to us. We have 2 more Workforce Innovation and Talent Centers set to open in Philadelphia in August. And we're looking to expand that across the U.S. We have 6 currently, and the goal is in the next 5 years to add 5 more. So these centers are one of the biggest ways we're really looking at addressing.
Thinking about that partnership, Castor, curious to hear your thoughts on where you think the public and private sectors can come together. What areas are, particular focus areas for you that rise to the top when it comes to that public-private partnership, and how you and your role can get more help from those who might be in the private sector?
So in the private sector, what we're looking for is assistance in public housing, where we create mixed finance developments, where we go out and build additional units, because there's lots of people who need affordable housing. And by using public funds and business funds and public and private funds, we're able to put additional affordable housing in the marketplace. But at the end of the day, with this program and this partnership, as I sit here and think about the impact it has on the community and the stuff that I see every day, you might not realize that programs like this really saves lives, because some of the trajectory that's low income people who might be in a situation now is not a bad trajectory. That means that the way their family is headed now, it could be a bad outcome. But by participating in this program and changing that direction, that's a significant impact. And then couple that with public funds, businesses funds, private funds to create affordable housing, where you create that baseline and get an opportunity to participate in this partnership that we have, can really change the direction of a family. So yes, public funds, private funds make a difference.
Reverend Dr. Campbell, last thing from you, if you could, drawing from your own history, out in the community as a community organizer, and in your role today, inspiring other people to get involved in helping, be the change, and help make a difference in people's lives. What would your advice be to the general public that's listening? How can they get involved, and how can they help make a difference when it comes to some of these issues that we're talking about here today?
Yeah, back to that, being willing to accept the proximity to poverty that's necessary to really make a difference. It's wherever you're at in your community. It's just volunteering. And there's so many programs out there that do such a good job, and it's usually a capacity issue, right? That, they don't have the resources to hire staff to run their programs, and not losing track of something that Mr. Binion said that is so important. It's about relationships. It's not just about giving someone food, but it's someone feeling like, because I have this relationship, I'm receiving this food. I'm not receiving this food because I'm poor. I'm receiving this food because someone cares, right? I'm not in this program because CVS needs employees. I'm in this program because people at CVS cares about the people in the communities, where they do business. And so it's thinking about, there's someone out there who doesn't think anyone cares. There's some child out there who sees other children and their life, and they look at their life and they say, wait a minute, no one sees this? Wait a minute, no one sees it? Hey, am I invisible? They're a child, like, who cares, right? I know my mom cares, but she doesn't have the resources. I know my granny and my nana, she cares, but what can she do? And then I see other people, and they see the same thing my mom and my nana sees, and they don't even care. And that can make such a difference. I had football coaches that lived in really nice neighborhoods, and they could have coached teams in their neighborhoods. And John Luce and Ron Darbo were my coaches in elementary and middle school, football coaches, rich white businessmen. And they made their son, Johnny Jr. and Ronnie, play on our team. And they came and coached our team in our neighborhood. They could have coached the team in their own neighborhood. And those guys inspired me, man. It's like, wow, they care. Why are they coming here? Other teams that were more affluent than our football team didn't get Burger King after their games. We did. And look, I'm calling those names today. I'm 50 plus years old and I'm still calling those names because those men cared, and they coached us all the way through elementary and middle school. And I'm still good friends with their sons, and that's how you can help. Go and volunteer or go and do something in a community that's underserved. And trust me, it makes a big difference. When people feel like somebody cares, that's inspiring enough. Just letting someone know that you care.
Thank you. John, last thoughts from you. Just close us out here. I mean, for those who might be watching this and, maybe they are in a situation where they're, working for a large company, or maybe they're the owner of a small business themselves. How can the business community get involved? I mean, you've been involved driving workforce initiatives at CVS Health for a long time. What have you learned that you can, give us some advice on real quick?
Well, there's not a lot more I could say that Pastor didn't just say, but it's get involved. Every little moment and every little interaction means a lot. We talk about, large companies, and large companies have resources. Bring your resources. Bring individuals, talk to people in your company and get them excited. Every company has colleague resource groups where they focus on certain things. Help them focus. Give them the time to focus in on the community. If you have a small business, go talk to people. There's people who go through these programs who want to start their own business, but they don't know how to. And your expertise would help so much for someone. And like Pastor said, just seeing someone who's done it, someone who came from where you are, someone who went through the trials and all the struggles that you did and now have made it. And we have those success stories all through every company. CVS Health is laden with them. They're everywhere with CVS Health. And that's where I think, every company can really come in and step up. It doesn't have to be money. It just has to be time. Give your time.
Thank you guys so much. It is so inspiring to hear about your stories, to hear your work, and to also just get your phenomenal advice about how we can all get involved and make a difference here. So thank you so much for joining us here today on this episode of CVS Health Live. And we encourage everybody else who might be interested and want to hear about some of the great programs that are being put into place, or even just become a little bit more inspired than hopefully we've managed to make you after listening to these stories here today. Just go check out the cvshealth.com website. There's an entire section on the workforce initiatives and some of the other programs that are being rolled out there. So you can get some great ideas from that. I'm Jessica DeMassa. I want to thank again our guests here with us today, John White, Castor Bingen, and Dr. Reverend Vincent Campbell. Thank you so much for being here with us. We'll talk to you guys very soon. Stay well.